Hi everybody, welcome to episode 4, our last episode of the physical health series. Today we're talking all things hips and shoulders. All right, how do we keep them strong and healthy with the unique demands that are placed on them with circus arts and other kinds of movement arts? We're going to start with the shoulder and then we're going to talk about the hips, but for both of them, we're going to go over some basic anatomy. We're going to talk about some basic biomechanics as well. We're going to look at common issues that can happen at these joints, all right? And then how do we not only just deal with those issues if they come up, but then how do we prevent them from happening? All right, so starting with the shoulder, we have our shoulder blade, all right? That connects to our clavicle or our collarbone, and it connects to our humerus, so our arm bone. We have muscles that stabilize the humerus, stabilize the arm bone into the socket of the shoulder blade. These are our rotator cuff muscles, our sits muscles, so supraspinatus, infraspinatus, teres minor, and subscapularis. We have a whole whack of muscles that move the scapula itself around and stabilize the scapula, so muscles that pull them in towards the spine, that wrap them out around the ribs. We have muscles that tilt them up and down, and also that tilt them forwards and backwards. We have our bigger muscles as well that function a bit more globally, so function for overall movement of the shoulder and arm together. We need all these different parts to work together for the shoulder to function most efficiently and most effectively. One of the most common shoulder issues that occurs, and the one I'm probably going to spend the most time with today, is impingement. And impingement just means that something is getting squished. It can happen in many ways in the shoulder. A couple of the most common ones are an impingement at the coracoacromial arch. This is where the collarbone and the shoulder blade meet, and there's a little space there that some of the tendons of our rotator cuff go through, as well as one of the tendons of our bicep. We also have some nerves, some blood vessels that go through there as well, and a bursa. If our shoulder isn't moving properly, any of those structures can get a little bit pinched in that coracoacromial arch, in that space, and that can cause an impingement and pain more so in the front of the shoulder, front side of the shoulder. A little bit more common with overhead activity is what we call a posterior impingement, and this is more likely to affect the supra or the infraspinatus, and it can affect part of the labrum. So the labrum, going like this, I'm not making a claw hand. The labrum is a piece of connective tissue that is in the socket of our shoulder blade, and it wraps around the head of the humerus. So if we look at just the scapula on its own, just the bone, we can see that socket is relatively shallow. So the labrum is connective tissue that comes around and essentially deepens the socket and gives us a bit more stability. So in a posterior impingement, supraspinatus, infraspinatus, and or the labrum can be affected. And with more of an anterior impingement, we'll have this really characteristic arc of pain sort of through the mid-range of our movement. With a posterior impingement, which again, more common in overhead athletes, so something that we may see a little bit more of in aerialists or different circus performers, hand balancers as well, that are overhead all the time. We're going to get pain more so at around 160 degrees of movement, so way higher up. And that pain as well is going to be more so in the back of the shoulder. Regardless of the cause or the kind of impingement, we can generally treat and manage it with correction of our mechanics. So what do we do about this? We can have all these things go wrong. How do we keep them from going wrong? Let's talk about the biomechanics first. Like we talked about before, the scapula, the shoulder blade, the clavicle, the collarbone, and the arm, they all have to work together. They have to move together. So this is my humerus. Here's the head of my humerus, the head of my arm bone. This is the socket of my shoulder blade. When we move overhead, and this arm wants to come up, if my shoulder blade doesn't move with me, I'm going to end up just hitting the top of that shoulder blade. Okay, I'm not going to be able to move well. All right, this can cause compression of the structures there. It can cause that impingement, cause that compression. All right, so I need my shoulder blade to be able to rotate with me to get that overhead motion, and then as well to rotate down. So if I'm up here, still not great. All right, if I'm coming down without the shoulder blade moving as well. How do we get these mechanics working properly? Step one, rotator cuff. Okay, these are really deep muscles. They're the ones that stabilize the head of the humerus to the shoulder blade. All right, and it's important that we make sure our rotator cuff knows how to work through its full range of motion. So I'm sure we've all seen, and we all get a little bit annoyed at, when we do those TheraBand exercises, coming across the body, coming open. Cool, that's nice, but we don't spend a lot of time just with hands by our sides. We have to be able to be stable at mid-range and then especially overhead. Now we have the muscles that move and stabilize the scapula. One of the main ones I'm going to talk about here, it's called our serratus anterior. It's a super fun muscle. It has a big name, but it's a really fun, not scary muscle. It comes from the middle of the shoulder blade and then wraps around our ribs. So its job is to protract the scapula, means bring it forwards, and it also upwardly rotates the shoulder blade, the scapula. When we come overhead, when I come up this way, our shoulder blade, like I just showed before, it has to rotate upward with us. We also want it, especially at the top, we want it to wrap forwards around the ribs. Okay, so sometimes we put our arm overhead, especially when we're more flexible. All right, a little bit more noodly, not necessarily just flexible, but when a bit more noodly, we can see somebody's shoulder blade stick out over here. That's not what we want to see. It looks cool for certain contexts, all right, but it is not stable. So when I come up, I want that shoulder blade to wrap forwards. The big thing I want to talk about here is when we are hanging. All right, and it's been all over social media, but I can't go through an episode talking about healthy shoulders without addressing it. The cue of shoulders down and back isn't always, there's context. Context is important, all right? But in the case of coming overhead, it's not necessarily our best cue because we need that upward rotation. So if I'm here and I am trying to pull my shoulder blades down, that is doing exactly what we talked about here, that if I'm up and then I'm trying to yank down, we can try different things like thinking about breaking our bar if we're on a horizontal apparatus, so like a hoop, like a trapeze. We can think about twisting, or like when you wring out a towel, wringing out the silks to help make that happen at the top. Okay, and we're always thinking about a little bit of a shrug up. We're not here, we're not stuck. Okay, but that's what we got to think about. We have to let that shoulder blade move with us as we come up and as we come back down. So now it's one thing to be able to stabilize overhead, all right, and get that proper motion of the scapula overhead. It's another thing to actually be able to get that arm all the way up, okay? Meaning to have the mobility to actually get there. We want to make sure that we have length and end range control through the muscles like our lats, like our pecs, that pull us back and pull us rounded, basically in the opposite motions of overhead. Okay, so when these muscles are tight, they're going to pull us into an internally rotated position, and they can also pull us down and forwards here. If I'm stuck here, it's going to be really tough to get my arm up. All right, if I can't do that, then I'm going to have to compensate somewhere else. So maybe I'm going to bend my elbows to try and get my arms overhead. Maybe I'm going to arch through my low back, or try and get my neck back to try and get more extension backwards, rather more flexion through my shoulder. So lats and pecs, really important that they are able to extend so that we can get to that safe overhead position. Another aspect of this we got to talk about is our thoracic spine. So that is our mid spine. If we are stuck in a flexed posture, okay, in a rounded posture, even if I have that full motion through my lats, through my pecs, I still won't be able to get my arm overhead because my shoulders will be down. Same deal here. If my shoulders are down, I can't get overhead. How am I going to compensate for it? I can bend the elbows. I can arch more through my back. And even though this can make it look like I'm getting overhead, it ultimately compromises our position. So I won't have as much stability, say in something like a handstand. I'm going to look like a banana if I'm arching more through my low back. I won't be able to get my arms straight in a back bend. Okay. Or I'm also going to start to arch. Say I'm just hanging from a bar, hanging from silks, whatever, whichever. I'm going to start sticking out my butt. And that makes it real hard to lift the legs and to come into that inverted position. Okay. So there are compensations for this, but ultimately it compromises the rest of our movement. And yes, increases our risk for injury. We know that, but it also decreases our ability to do the motions that we want. The last little bit here about the shoulders. We've got our movement down. That's awesome. We're nice. We're strong. When we're doing one or more of the other, so whether we're pushing more than pulling, we're pulling more than pushing, we need to balance it out so that we don't get really strong with one and really weak with the other. So this can be in the form, say we are an aerialist and we do silks, and all day long we are just climbing up and down. So adding in some handstands, or it can be something like push-ups, downward dog push-ups, a half kneeling press, a military press, just like a regular shoulder press overhead into your conditioning. And it doesn't have to be an everyday thing. It can be a once or twice a week, I add in 2-3 sets of some sort of pushing exercise. That can be really beneficial to help keep the shoulders balanced. And same on the other side for my hand balancers, for my tumblers, for my hand-to-hand bases that are pushing up through their arms quite a bit. We want to add in pulling. So whether that's if you're training in a circus gym, doing some climbs, whether that can also be pull-ups, or if we don't have that kind of equipment around us for whatever reason, banded rows, weighted rows, banded pull downs, okay? Whatever is available to you, something to work the opposition, to work the other muscles is better than nothing. And again, it doesn't have to be a lot, but adding in 2 to 3 sets of the opposite kind of exercise 2 to 3 times a week can be really beneficial to help stay balanced. So to finish up talking about the shoulder, we need to make sure that our rotator cuff is really strong to stabilize and that it's strong through our full range of motion. We have to make sure that we're able to move the scapula as well through its full range of motion, and to do that coordinated with the arm. Once that's okay, then we also need to make sure that our muscles can actually let us and be long enough to be able to get into those more extreme overhead positions. Then we also need to look at our thoracic spine, so our mid spine. If we are stuck there, then we're also going to have a lot of trouble overhead and then with overall movement of our shoulders. Exercises for all those different things are in the show notes, are linked below. Okay, and I want to be really clear here that if you are currently experiencing pain, you're currently experiencing any symptoms like numbness, tingling, or burning, get yourself checked out by a medical provider when you are able to. This is for general maintenance and keeping things happy and healthy. And heck yeah, if you add them in, it may help alleviate your pain. But for the sake of longevity, this is not medical advice. This is just guidelines on how to help promote health of our joints and proper mechanics to decrease our risk of injury and increase our longevity here. So now let's talk about hips. So similar to the shoulder, the hip is also a ball and socket joint, only in this case, we have the bone of our thigh, our femur. The head of the femur inserts into the socket on our pelvis. This socket is a lot deeper. We still have a labrum that comes around, okay, but we have a lot more inherent stability at the hip compared to the shoulder. Not to say that we don't get our own slew of issues at the hip, but just comparing the two joints, the hip is a lot more stable. Same like the shoulder, the femur needs to be able to move within its socket at the hip, okay? And when we have issues in this movement, that's what can cause pain. I want to be really clear here. Impingement at the hip is different than impingement at the shoulder. When we talk about impingement at the hip, usually that means that, like, a true impingement means that there is a bony outgrowth from either the socket, so the portion on the pelvis, or from the femur, and it's an extra bony outgrowth that then causes things to not move properly. All right, that is a true impingement at the hip. It is different than impingement at the shoulder. In that, we won't see like any extra bone. It's just poor movement. Impingement at the hip, we have some extra bone growth. We still need to make sure, again, that we can move properly here. If we're not moving properly here, the same thing can happen, that we butt up against the socket. Okay, we can get stuck there, all that kind of thing. So now what I want to go over today here is talking about how to keep all those muscles that surround the hip strong so we can get that proper movement, as well as staying balanced in those muscles. Okay, so the muscles that flex the hip, so bring, let's say, the knee towards the chest, versus the muscles that extend the hip, bring the leg behind us. The muscles that abduct and adduct the hip, so bring the leg up to the side, bring the leg down and across the body, and that rotate our hip in and out. Same like the shoulder, if we're really strong in one and not the other, we can have pain, we can have an increase of injury, etc., etc. So we're going to go through, and again, this is quite general. These exercises may be able to help you get over an injury, but this isn't necessarily treatment for any specific injury. We're talking about how to maintain health of the hip and maintain balance in those muscles to prevent injury. Okay, so starting off here, and in no particular order, we have our glutes. We know them, okay? Glute max, we got the big one on the back. We have our glute med and min, which are a bit smaller underneath the glute max, a little bit more to the side as well, rather than covering the whole back. Underneath all of those, we're going to get to those in a second. Underneath all of those, if we peel them away, enjoy that visual, we have our deep external rotators, okay? These are 6 muscles that function to externally rotate the hip. So turn the hip out. Exactly, turn out. That is the function of these muscles. If they are not working as well as they could be, if they are not as strong as they could be, that external rotation, which is, again, that turnout, which isn't always, but is often our default in technique for circus arts, for a lot of other movement arts. When they aren't as strong, these external rotators aren't as strong, then it's possible for muscles like our glute max, like the iliopsoas, to take over for them instead. And we know it, I'm going to say it like 50 more times this episode, that if they are compensating, they are working harder than they need to be, which then increases our risk for injury and compromises their ability to function for their main job. So in the case of the glutes, if the glutes are compensating for hip extension, for absorbing force from landings. If it's our iliopsoas that's doing more of the compensating, it could be both together, but say it's the iliopsoas, that is the hip flexor. If it's overworking, we're going to have either a really tight hip flexor, or we can have weakness with hip flexion because it's overworking. Okay, so when we're trying to achieve that turnout, that long line aesthetic through the leg, through the hip, those deep rotators are really important and often neglected. When they're weak, our bigger muscles take over, increasing our risk for injury, decreasing our ability to do other movements effectively and efficiently. Moving on from those, we have our internal rotators. So we have relatively less internal rotation compared to external rotation at the hip. That's normal. And our internal rotators are a lot smaller. So we're not going to be as strong in it. That's fine. But we do need to be able to internally rotate our hip, and we need those internal rotators to be strong. If we lack adequate hip internal rotation, then we're going to be limited in our hip flexion. So hip flexion is bringing the knee towards the chest, closing the angle of the knee, or closing the angle of the hip in the front. If we lack internal rotation, this can contribute to that pinchy feeling we can sometimes get at the front of the hip in movements like a pike, in movements like a straddle, like a forward bending straddle. Okay, any sort of forward bends that involves hip flexion, closing that angle in front, we need internal rotation. And like we talked about, thinking about that hip, if we don't have that good internal rotation, we don't have control through our internal rotators, we can get poor movement here. So rather than getting a good glide, we can abut against the bone and we can get that pinchy feeling. We won't be able to get as deep into the movement. That slack then is often going to be taken up by our hamstrings or by our low back. And again, compensations, overworking increases our risk for injury, decreases our longevity. So after internal rotators, let's talk about hip flexors. So again, hip flexion is when we are closing the angle of the hip, okay, bringing the leg, the knee in front of the body. Now, we can have hip flexors that are tight and weak. We can also be tight and strong, but overactive. Neither are great, okay? Regardless, if we look at our hip, when we come into flexion, these muscles, whether they're tight, whether they're overactive, can kind of yank on the femur. And rather than getting that glide and roll back, we just get, yeah. And that's when we can sometimes also get that kind of pinching feeling, that uncomfortableness in the front of the hip. This is also where we can get something called snapping hip. If you've ever gotten that pop feeling when bringing your leg towards your chest or on the descent down, or the same when coming with the leg up to the side or on the descent down, coming down from the side, and we get that pop and we feel it more inside of the hip rather on the outside of the leg. While this is relatively benign, sometimes it has pain, sometimes it doesn't. It can lead to irritation, and it also really tells us that those hip flexors aren't working the way that we need them to be. So as always, exercises to help strengthen those hip flexors and strengthen the control that we have over our hip flexors through those full ranges of motion are going to be linked at the bottom here. Okay, but it's an aspect that we have to consider when we are looking at overall health of the hip. Next up, our glute max. Okay, so this is our biggest butt muscle, big booty. This one works for hip extension. It needs to be strong, so extension bringing the leg behind us. So if we think about our split, that front leg is in flexion, that back leg behind us is in extension. It needs to be strong to be able to help the hamstrings, okay, and to help the low back. Because often if our glutes are weak, then the low back is going to try and extend, or those hamstrings that our hamstrings insert onto our sits bones, okay, so onto our butt bones. If you're sitting, wiggle around a bit, feel them. That's where our hamstrings come to. They'll also help to extend the leg. If the glutes are weak, then the hamstrings are going to have to work a lot harder to get that extension, or both can happen. We're going to get more of that extension through our low back rather than through our hip. Our glutes provide stability, and power and strength for absorbing landings, okay, and also for takeoffs. It's important that we learn how to engage our glutes in back bending. So we get that, again, hip extender. So we get that, that more even bend through the body rather than localizing the bend to one aspect of our spine. Last one we're going to talk about for hips, last muscle we're going to talk about, okay, and then I want you to go into the notes, look at these exercises for how we can apply them and how we can strengthen all together to keep those hips really nice and strong and healthy, is our adductors. Now we always want to stretch the adductors. We want to pull them apart, get that big wide straddle, lovely middle split, okay? But we need them to be strong. If we are going to ask them to go every which way, they have to be strong in those end ranges to avoid things like tears, okay, like a tendinopathy. So like we spoke about in the last episode, things like pubalgia or osteitis pubis. Our adductors also function as they help us with hip extension. Okay, so they are adjuncts to that. Without them, then the same. Our hamstrings are going to have to work harder. Our glutes are going to have to work harder. Let them be there to help take up some of that work. Let's summarize the hip here real quick. We need those deep external rotators to be working so we can get that turnout without our hip flexors or our glutes taking over. We want our internal rotators to be really nice and strong so that we can get that good pike, okay, that good forward fold. Our hip flexors need to be strong and we need to be able to control them so that they are not just doing all the work. They love to do a lot of work, okay? They love to take over. They love to be overactive. We need to then also make sure that our glutes are working really hard, our glute max specifically, because that helps extend the hip, okay, opposite than our hip flexors. We're extending. That hip extension is super important for our back bending, all right, and to keep that back bending safe and not just crunch our spine. Our glutes are also so important for takeoffs and landings and creating that power. The last one that we're talking about today is our adductors, okay, so the muscles on the inside of the leg that pull the legs in. When we have such big needs of flexibility and the need for a really nice big straddle in circus arts and other movement arts, we have to keep those adductors strong so that they are safe in those extended positions. Okay, our adductors also help with hip extension. So having that extra little love for our hamstrings and glutes is always a bonus. Okay, so that we don't have to add extra work for those muscles. Take a look at the videos below. They're going to go much more into detail on how we do those things, how we get strong there. Again, please go take a look at those videos. They're going to show how to actually implement the concepts that we talked about today, okay, and how to train them. Last thing with all of this, it doesn't matter how many exercises you do, how much conditioning you do. If we don't cover our basics, our body will not function optimally. Like we talked about first episode, okay, there's a reason it was first. Hydration, nutrition, sleep, and stress. We need to make sure that we are fueling for our workouts. We need to make sure we are staying hydrated before, after, and during our workouts. All right, this is important for health of our body, yes, but really for health of the muscles, okay? A tight muscle or a dehydrated muscle is a tight muscle. We need to make sure we are sleeping properly so we can actually recover from the stresses that we're placing on our body through training, okay, through performing, through teaching, again, whatever it is, just let it be all-encompassing. Along with that recovery is the nutrition portion, adequately fueling before, after, during, so that we can perform. Our body has energy to do the movements that we want, and our body has the energy to recover from them as well. And lastly, I know it's a doozy, I'm gonna say here, yeah, manage your stress. Finding strategies to minimize the stress in your overall stress bucket is really important, okay? the higher our overall stress in our stress bucket, like we talked about in our first episode, the more likely we are to get injured. And you can be super strong and your joints can be super healthy, but if our body is running on fumes, our risk for injury goes up. If our head is somewhere else while we're training, the risk for a mistake goes up. Okay, so finding ways to manage stress is really important for overall keeping our body healthy. Thank you so much, everybody, for joining me for this. Please don't be shy. If you have any questions, send me a message on CircusTalk on Instagram. Send me an email. Anywhere that works best for you to talk about how to keep your body healthy while training, while teaching, while performing, while doing the things that we all love and make us happy. Thanks so much.